Doctor, what fillers do you use in your practice?
I mainly use, Tom, I use the hyaluronic acids, which are typically the Perlane and the Restylane. Those are my kind of workhorse types of fillers. I also use the Radiesse, which is the calcium hydroxlapatite, occasionally for deeper type things. I do use the Collagen for very, very fine creases, little so-called smoker's lines maybe, or a little defect that's in the face that needs a superficial filling. The collagen is a superficial filler. As we get those deeper hyaluronic acids are deeper, the calcium hydroxyapatites are deeper than that.
And again, all of them have their roles. It just kind of depends on the work.
Correct.
That needs to
You've got to match the problem with the solution.
All right. Let's take a look now at some of the results achieved using some of these products.
Sure.
We have to tell our viewers, so in some cases these are submitted. In fact, I think in all of these cases we're going to show you now, you've seen some of the doctor's work already. These were actually provided by the manufacturer of the products.
Exactly.
But these are typical results that you have seen in your office.
These are typical results that you see in brochures and all that, right. This first one you can see on the left, this is a gentleman, so it's not just used in women, it's used in men as well. And I have done a lot of injection in men as well. You see the deep creases that are coming down from the nose to the corner of the mouth, and also some downturning of the corner of the mouth. This is after 3 syringes filling on the right-hand side, and you can see that those creases are markedly smoothed out. See the corners of the mouth are not as downturned as well.
Next slide is also a Restylane patient.
Right. Again, this lady, and most people are asymmetric. That's normal. So the beauty about this is you can put more on one side versus another. You use it as you will, or as you need, to fill in the defect. She obviously has a crease, again on your left-hand screen, that's deeper on her right than it is on her left. And there it is filled out on the right-hand screen with 2 syringes of Restylane.
And again, these are fillers, so the results are immediate. You're not having to guess, hey, what am I going to see a week from now?
Correct.
What you see is what you get at that point.
What you see is what you get on these types of fillers, yes.
Okay, let's move to Perlane now, and what do we see here?
Perlane, a little deeper injection in a deeper dermis. This is a younger individual that you can see, and this is after, again, the pre-injection on the left, the deepening in those folds, and it just makes you look a little tired. And by filling those, it really rejuvenates your face. And a lot of times people will see these people after they've had it done, and they'll know something's different, but they can't really pinpoint it, and they know they look better. And that's really what you're shooting for.
The result there is dramatic, and then we have it on a woman. Same thing, Perlane.
Same thing here. Again, she's got some deepening of it's called melolabial creases. That's from her corner of her nose down to the lateral aspect of her mouth, and those are filled in there. She still is able to move. You can see she still smiles, still has dimples, but it's just smoother and more rejuvenated there. The
last product we want to look at, or product, is Juvederm before and after.
Right. This is another product. This is a little bit more cross-linked product. So it
by cross-link, what do you mean?
It's the cross-linkages of the hyaluronic acid draws in moisture. That's how it maintains this. Now, with Juvederm and even there are other products out there that are even more cross-linked, you typically have to undercorrect so that you're allowing for the moisture that's drawing in. So you're undercorrecting a little bit in here, using the creases. You can see in her lips as well as in her melolabial creases, and this is, I don't know, this is, oh yes, 4 weeks. I see it right there, yeah, afterwards. So that's what you can expect from there.
So with Juvederm, and we have one more picture, this is Radiesse.
Radiesse, this is the calcium hydroxyapatite, and it's used, again, I use it in deeper kind of folds around the kind of jowls areas. I use that a lot. Not so much in the melolabial creases, but it can be used there safely, and this is obviously a patient that has had that done as well. A deeper product where you place that a little bit deeper, and you can see a very good result at 14 months. And here's the thing for the plug for Radiesse, is that it does last longer. And you can see that's 14 months with 1 syringe of it.
Very good. I want to thank Dr. Devon Graham for the information you have provided us for tonight, and for your work at Ochsner and in this area. Thank you so much.
Thanks so much.